My name is Kamath. I'm an interventional cardiologist at Goshen Health. I initially did my medical school in India and then did the residency in internal medicine in India as well. And I did a repeat internal medicine, that's a requirement here in the US, in Dayton, Ohio. I did a year of heart failure research at University of Cincinnati, Ohio. Then I did my cardiology fellowship at Medical College of Wisconsin, where I was also the chief cardiology fellow. Then I worked at Cleveland Clinic for 2 years as a practicing cardiologist before I pursued my interventional cardiology training in Houston. I am passionate about all aspects of cardiology. I have interest in heart failure, electrophysiology, all aspects of cardiology, even though I'm trained interventional cardiologist. We do see patients with multiple medical conditions. It could be chest pain, could be heart failure, it could be arrhythmias. So multitude of heart problems are seen on a daily basis in our practice. I do heart catheterizations, balloons, stents, special procedures, peripheral vascular procedures, balloons and stents for the legs, arms, kidneys. So prevention is the key to success. That's what I strongly believe. So if you do see that a patient has multiple coronary risk factors and or any concerning symptoms, that'll be the right time to be referred to a cardiologist for detailed discussion evaluation, because the cardiologist can evaluate the patient from a different perspective and can offer suggestions and discussions that could be helpful for the patient. If the provider feels comfortable doing testing before being sent to cardiology, that is perfectly fine. But if there are concerns whether a patient would need or would be the appropriate testing, most certainly we'll be more than happy to take care of any and all. Goshen Cardiology is offering any and all complex procedures, including left ventricular assist device procedures, complex coronary rod ablation. Any and all complex procedures are offered through Goshen Health. Patients at Goshen do not have to go outside the Goshen for a detailed cardiac care. A unique feature of Goshen Heart and Vascular, as the name suggests, there's a very collaborative approach between cardiologists, vascular surgeons, and interventional radiologists. We meet every week to discuss our cases, and that we plan as to what would be the treatment strategy for the patient. And the integrative relationship between cardiology, vascular surgery, and interventional radiology leads to an excellent comprehensive care for the patient. And if a person needs a particular care and that cannot be offered by a cardiologist, then the care is offered by an interventional radiologist or a vascular surgeon. So it's a very collaborative relationship between multiple subspecialties.